My name is Ted. I have mixed, receptive, expressive language difficulties. Expressive language affects my ability to ask for things, make comments, or even get people's attention sometimes. Difficulties with receptive language have an impact on understanding what is said to me. Typically, receptive or comprehension develops ahead of expressive language. I have no issues hearing or pronouncing words, but I struggle to understand and use spoken language, and will continue to do so for the rest of my life. Language difficulties, disorders, or impairments can be developmental or acquired. My language difficulties were noticed quite early by my parents and teachers because I wasn't progressing at the same rate as others my age. The cause of developmental cases of mixed receptive expressive language disorders is an issue that stirs debate. Most research focuses on the broader category of speech and language impairments, or SLI, which involves both language and speech disorders. Recent discoveries by the National Institute on Deafness and Other Communication Disorders, NIDCD, suggest a strong genetic link and have said that 50 to 70% of children with SLI have at least one other family member with the disorder. According to the New South Wales Centre for Effective Reading, approximately 7% of children are affected by language difficulties just like me. It is one of the most common childhood learning difficulties. However, each child with a language difficulty can vary considerably in their abilities. This is because language difficulty is a very broad term that can include all aspects of language. When my parents first recognized my language difficulty, there was great confusion due to the extensive range of possible labels. Consequently, lack of agreed terminology is the cause of many concern for teachers relating to this topic. Along with the misunderstandings teachers face, terminological confusion can also contribute to the lack of research conducted. Bishop, 2014, explains that it is difficult to assemble information because of the multiple terms. Therefore, despite the frequency and impact of language difficulties, the research funding and published papers are limited. This leads us to the issue of labeling. There is a place for diagnostic labels in terms of advancing understanding of these language difficulties and identifying students like me who will benefit from intervention. With these benefits, though, comes potential for negative consequences. Some of these include too much focus on a label without the consideration of environmental factors, excusing bad teaching, children left feeling inferior, being stigmatized or excluded from various activities, and resources denied to children who are not formally diagnosed. It is generally parents or early years teachers that identify language difficulties in children that can lead to formal diagnosis. Teachers should be aware of verbal language difficulties their students may display, and then use a screening tool such as the grammar and phonology screening test to assess grammatical and/or phonological deficits students may have. When I was being formally diagnosed with a speech-language impairment, a speech pathologist used language assessments such as the Clinical Evaluation of Language, Fundamentals, Australian Standardised Edition. I now require ongoing individualised education planning and sometimes work with Education Queensland speech-language pathologists to develop my language skills. There are many evidence-based teaching strategies that teachers can employ to assist all young Australians becoming successful learners, confident and creative individuals, and active informed citizens. One teacher that had a massive impact on my learning was an advocate for the universal design for learning approach. When used appropriately, the UDL framework allows implementation of teaching and learning experiences that cater for and develop all individuals' knowledge and skills. With all this said, my final message for you as students, parents, or teachers is that kids with learning difficulties are just as smart as everyone else, and for us to show our full potential, we just need to be taught in ways that are tailored to our unique learning style.